Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So this is our introduction video to our respiratory system, and in this video, we're going to talk, of course, about the introduction to the respiratory system as well as diagnostic procedures that you should know or you will see in relevance to the respiratory system. So the respiratory system. The respiratory system consists of various organs and structures used for gaseous exchange in the body. And this structures include the upper airways, the lungs, the lower airways, the alveoli. The lungs actually help the body in oxygenation and tissue perfusion as well as gaseous exchange. Diagnostic procedures of the respiratory system. So we can break them up into non-invasive and invasive. So with our non-invasive procedures, we'll have our chest x-ray, and we normally have the patient who is of childbearing age wear or use a lead shield prior to a chest x-ray. We'll also have the pulse oximetry, pulmonary function test, sputum test, our CT, computer tomography, and also our magnetic resonance image, MRI. With our invasive procedures or diagnostic tests, we have our arterial blood gases, ABGs, that we talked about in our fluid and electrolyte series. And with our ABGs, this is normally via an arterial puncture or an arterial line. And with this, when you take a sample for this patient, always remember you have to put pressure up to 5 minutes. And if a patient has a high risk of bleeding, like on anticoagulants, you'll have to do it longer. And it's normally performed, actually this allows for the most accurate method of assessing our respiratory function, and it is performed after an Allen test. If the arterial line is function, a sample is actually drawn into a heparin syringe. We keep it on ice and transport it to the lab immediately. We document the amount and the method of oxygen delivered for accurate results. So if somebody is on a nasal cannula 2 liters, we always note that the patient is on nasal cannula 2 liters. Okay. And we apply direct pressure, as I said, to the puncture site for at least 5 minutes and longer for patient who has risk for bleeding, and we monitor for hematomas. Bronchoscopy. What is a bronchoscopy? A bronchoscopy actually visualizes the larynx, trachea, bronchi, and we obtain either tissue biopsy or we remove foreign bodies. So we always, since it's a invasive procedure, we obtain informed consent and we maintain the patient 8 to 12 hours NPO because of what? A risk of aspiration. And with informed consent, your work as a nurse is to observe that the patient signed the consents willingly and the consents are signed. Your job is not to actually educate the patient on the procedure. That is the MD's job. We provide local anesthesia to the throat through a spray. We will position the patient upright. We'll administer meds as prescribed, atropines to decrease like oral secretion and sedation, and also anxiety medication. We'll take the lab specimen. We will observe post-procedure for what? Gag reflex, bleeding, and respiratory status and vital sign, as well as level of consciousness. Remember, it's an invasive procedure. Mantu Test. What is a Mantu Test? A positive test is an indication of exposure to TB for a diagnosis to be confirmed through a sputum test, right? And this sputum test is known as the acid-fast bacil test, the AFB, and it must be performed for you to actually diagnose the patient with TB. We administer 0.1 ml of the solution, which is normally a purified protein derivative, intradermally with bevel up. It's a very small thing. Normally you need to see a wheel to know that you really did it well. The assessment for it is actually completed 48 to 72 hours after the injection, and a 10 millimeter or greater is an indication of a positive. And for patient who's immunocompromised, 5 millimeters is actually considered positive. And when you get a positive Mantu test, the patient is not considered to be TB positive, but TB exposed. We always remember you have to perform the acid first basil test for the patient to be considered a positive tuberculosis patient. And we have the Quantiferon TB golden test, which identifies the presence of the Mycobacterium tuberculosis infection by measuring the immune response to the TB bacteria in the whole blood. We also have another procedure called the Thoracis, and this is a surgical procedure. And remember, invasive, you always have to take consents, right? So it's a surgical procedure which entails perforating the pleural space to obtain specimen, fluid, or removal of air, or even administer medication like to that specific location. And some interventions or nursing care that we normally perform to this patient after a thoracis will be always obtain informed consents. We are client education. We remain still. This is what we tell the patient about. They need to remain still. They'll feel pressure and they'll be positioned in an upright position. We always monitor for respiratory status and vital signs because we are going to the pleural space, and if something happens, they could end up with like a lung collapse. We always, the maximum fluid that can be removed is 1 liter. And we always document the amount, color, and viscosity. And why are we removing only 1 liter? To avoid hypovolemia. And the chest tube is always placed at the bedside in case of a collapsed lung. And the chest tube, we need to have the oxygen there. We need to have a suction machine, those kind of things. It's respiratory. And we always obtain a chest x-ray before and after the procedure. So let's get into the different disorders of the respiratory. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.